Hi, my name is Dr. Verdoliva, but they call me Dr. V. I'm originally from Italy. I moved to Oregon 15 years ago, and I'm happy to work at Pacific Veterinary Hospital. Ultrasound, which is my big passion. I've been doing ultrasound since I was in Italy, so it's been over 15 years. I had many mentors. They teach me, and I was lucky enough to practicing abdominal ultrasound. This is my specialty. Today we have Addi. Say hi. And she's our special patient. She's 9, almost 9, and she has a history of muscle tumor, and we are monitoring her spleen specifically to see any change. Unfortunately, surgery is not an option. What I'm doing, we're just monitoring the spleen for any abnormality that will give us a clue that the tumor spread in the spleen. We did it's called FNA. We took a sample of the spleen, I think 6 months ago, and the spleen was clean, and so we celebrated, and now we're just monitoring. So we have a human-grade ultrasound machine, exactly the same the human doctor use. It's brand new. We purchased a year ago. Has different setting, and we can use for cats and dogs. And every ultrasound I do will send the imaging to a board certified radiologist, and we'll get the radiology report, and based on their recommendation we'll do a follow-up. We can take sample if we see any abnormality, and when I think about sample, fluid in the abdomen, or tissue sample from liver, spleen, any mass we see. You know, my protocol, I start from the liver, and then I move to the stomach, and then I look at the kidney, and then the spleen, and the intestinal, and then the bladder, and then I will check for fluid in the abdomen and lymph nodes. And it's not painful. It takes about half an hour. They put some gel in their tummy, and then voila, we'll see stuff. And you can see, oops, on the top, it's the spleen. We can make it bigger so we can see better. And we freeze, we label, we save the imaging, and we ship to a radiologist. As you can see, it's not invasive. You know, ultrasound, it's really like no traumatic for the dog or the cat. And if I see any sign of stress, sometimes we give a little help to make them relax. But there is no pain involved and no stress. We take our time, we stop if we have to stop, and we continue if the cat or the dog will allow us. So that is a great tool. It's another diagnostic tool. So when do I recommend ultrasound? In this case, we're using for monitoring for metastasis, cancer with spread in other organs. So instead of opening the abdomen and look for something, we use imaging. For dogs with chronic vomiting and diarrhea, same thing for cats, and the blood work is like within normal limits. Ultrasound can give more information. Foreign body, pregnancy, and like in case of Addi, monitor for metastasis, so cancer. When the clinical sign and the blood work and they point us to investigate more, then ultrasound is a great tool because it's not invasive, it's not traumatic for the dog or the cat, and will provide a lot of information. And you know, it's like another piece of puzzle. Then you put all the puzzle together to understand why my dog is not feeling well. why my cat is not feeling well. Ultrasound really help us to give us more information. You might ask what is the difference about X-ray and ultrasound. They are complementary. So abdominal ultrasound is one of the many tools we have at Pacific Veterinary Hospital, and Addi's been very patient with us, and say bye and see you.